Hey skin enthusiasts, Dr. Afton Cobb here, dual board certified dermatologist and Mohs surgeon, and today we're talking about topical retinoids. Specifically, it's a question that's on everyone's mind. It comes up a lot. The question is, when is it appropriate to start using a topical retinoid and anti-aging skincare products? So before we dive in, make sure to hit that subscribe button and click the little notification bell so you can stay tuned to all my future skincare tips and advice. In today's video, we're going to talk about at what age you should actually start using topical retinoids and anti-aging skincare products. I'm also going to be talking about what topical retinoids are and why you should use them in your skincare routine, and I'll also go over how to apply them to minimize side effects and get the most benefit from the products. Make sure to stay tuned till the end because I'll be giving my 3 favorite skincare products for topical retinoids. Before we dive into when you should start using topical retinoids, first I want to go over what they are. So you've probably heard the term retinol, R-E-T-I-N-O-L with an O, and that's the layman's term for how a lot of people refer to what the correct term would be topical retinoids. When we refer to topical retinoids, we're referring to a class of vitamin A derivatives, whether they're naturally occurring or synthetic, that have vitamin A activity. Vitamin A activity has a lot of different properties in the skin, and we'll dive into that a little bit more. The way vitamin A derivatives work is the retinoids get translocated into the nucleus of the cell, and they bind with receptors called RAR and RXR. And depending on which of those receptors they bind to, they can have slightly different properties in the skin and in the body. When they bind those receptors, they work to increase DNA transcription to upregulate genes directly, and then they downregulate other genes. So when we use topical retinoids, we're using them because we actually know that they have effects in changing how the genes are expressed in the skin. And this can manifest as upregulation of collagen production. Increasing collagen production helps minimize fine wrinkles. Topical retinoids can also help prevent the very first formation of acne, which is the comedone, and they do that by regulating cell turnover so that the cells mature and grow more evenly, and you're less likely to get plugging of the sebaceous unit where that can eventually lead to acne. So in addition to helping with fine wrinkles, topical retinoids can also help with acne, and they also can help with pigmentation. In studies where they look at skin that's been treated with topical retinoids, they can see that the melanin granules, which are the little pigment granules, are more evenly dispersed in the skin that's been treated with vitamin A derivatives. And that's important because we can use topical retinoids to help minimize blotchy, uneven skin tone and minimize brown spots and discoloration. So vitamin A is found in the skin in the form of retinol esters and retinol. And these forms in the skin actually can absorb UVB radiation from the sun. And that's why retinoids can help minimize damage from the sun, photoaging, and they actually provide about 2 to 3% blockage from UVB rays. When the sun is penetrating onto the skin, it depletes these vitamin A forms, the retinol esters and retinols, and that's why you can get even more damage. So by adding back in a topical retinoid, you can help replete those naturally occurring vitamin A derivatives to help minimize damage from the sun and the environment. So for all of these reasons, that's why vitamin A is a powerhouse skincare ingredient that everyone's talking about, everyone wants to know about, and I bet if you polled the dermatology community, most dermatologists are using a topical retinoid of some sorts. So to summarize, topical retinoids exhibit vitamin A activity in the skin, and they help regulate cell turnover to minimize acne, they help boost collagen production, and also minimize collagen breakdown to give a more youthful appearance by minimizing fine wrinkles, and they can also help even out skin tone. If you've come here on my page, you're probably somewhat of a skin savvy acne person, and you've probably seen there's a lot of different forms of vitamin A. I think one of the most confusing things about topical retinoids for consumers when you're buying an over-the-counter product is trying to distinguish between the different forms of topical retinoids and know which one is more effective or why you might choose one over the other. So to understand this, we have to go into a little bit of a science lesson. The strongest form of topical retinoids and the biologically active form of a retinoid is retinoic acid, and that's where we get our product tretinoin. The over-the-counter products that we have are all different versions of vitamin A that have to go through a series of steps to be converted into that biologically active form of retinoic acid. So the main forms in our body in terms of how we store them in the body and how we ingest them are retinol and retinol esters. Retinol esters, such as retinol palmitate, are one of the storage forms of vitamin A. It can be found in the liver, it can be found in the skin. Retinol palmitate has to be converted to retinol, and then retinol has to be converted to retinaldehyde, and then retinaldehyde has to be converted to retinoic acid. So we think of topical retinoids in terms of their efficacy and their ability to cause side effects based on how far along in that pathway they are. So retinaldehyde is the step that's immediately before it gets converted to retinoic acid. So there's less needed to get to that final step of the biologically active form. So in over-the-counter products, retinaldehyde is going to be a little bit more effective, a little bit stronger, but also could be a little bit more likely to cause side effects like skin irritation. Retinol is the step before retinaldehyde. Then you have to go retinol to retinaldehyde to retinoic acid. So you have an extra step in there. So it's thought to be a little bit gentler, a little bit less side effects. The form of retinol palmitate is probably going to be a little bit more gentler than the other products, less likely to cause any side effects, dryness, but also you may not be getting as much efficacy from it because the retinol palmitate has to be converted to retinol, then to retinaldehyde, and then to retinoic acid before it gets to be that active form. So you can use that to your advantage when you're picking out a product. If you have a lot of trouble with topical retinoids and just get lots of irritation and lots of dryness, you might actually want a product that has retinol palmitate in it because it will be a little bit easier to tolerate on your skin. On the flip side of that, if you're looking for one of the stronger over-the-counter topical retinoids, you could look for a product that has retinaldehyde in it, or you can go for adapalene, which we also know is one of the stronger, more potent over-the-counter topical retinoids. Adapalene can be found in the acne aisle. It's usually marketed under the brand name Differin. The Roche-Posay also carries an adapalene product under their Effaclar Duo line, and it's a really great option for treating acne. It actually used to be a prescription medication. It was FDA approved for the treatment of acne in 1996, and then after various studies showing that it was safe, it was approved for over-the-counter use in 2016. And so this is an option that a lot of dermatologists use as a first-line treatment when we're treating acne. It's fairly inexpensive. It's about $14, and the nice thing about it is that it's a little bit more photostable than tretinoin, and that means that it doesn't break down when exposed to light as easily as tretinoin does. So technically you could use adapalene in the morning and get away with it, although usually I just tell patients to do it at night because we're sometimes switching around the topical retinoids and it's easier just to get into the routine of doing your retinoid at night. But technically you could use adapalene in the morning. The other thing is that adapalene is more lipophilic, meaning that it immerses better with fat, and as a result, it gets better absorbed into the pilosebaceous unit, which is where like all the oil glands are, and that's where acne first forms. So it penetrates into the areas where we need it most for acne. So it's thought that adapalene works a little bit better for acne than, say, a tretinoin. Adapalene has been less well studied in the world of anti-aging and minimizing wrinkles, we still consider it to have anti-aging properties and to help with collagen production just because of the similar mechanistic pathways that it works through. We just don't have as much clinical data to support that. Another alternative topical retinoid is a product called bakuchiol. It's a seed extract that comes from a plant called Sorelia corifolia that comes from India. And in small studies, it has been shown to have efficacy in boosting collagen production and also helping minimize acne while being better tolerated with less side effects than other topical retinoids. So even though it's newer and we don't have as much data, this is another option that could be good for a topical retinoid. The downside of topical retinoids is that they can cause dryness, irritation, sensitivity. There's a lot of strategies though that you can do to try to minimize these side effects. The other thing you should know about topical retinoids is that pregnant women should not use topical retinoids. Vitamin A is really crucial to the developing baby, so if we give the body too much vitamin A, it can disrupt the normal maturation of a baby. So even though topical retinoids haven't been demonstrated to be associated with any birth defects, it's safer to just avoid them during pregnancy because the risks of anything bad happening outweigh the benefit. If you're thinking about starting a topical retinoid, make sure to consult a board-certified dermatologist so they can actually give you specific recommendations based on your skin type and your skincare needs. And now, the answer that you've all been waiting for: at what age should you start using topical retinoids? So to that, I would say it really depends on what you're using them for. In dermatology, we might start teenagers on topical retinoids because we use them to treat acne. And so in those cases, it might be appropriate to start topical retinoids in the early teens. Sometimes we even use topical retinoids in babies if they have really rough skin or for certain medical issues. If you're using topical retinoids with the purposes of anti-aging for minimizing wrinkles and improving skin tone and improving brown spots, I would say in your 20s, because the longer you're going to use these, you're going to have an added benefit over time. And there's no magic answer, no magic number of when you should start exactly. There's no downside to starting earlier, but there is a downside to starting later, which is that you would just get less years of that added protection from aging. So now that we've talked about the benefits of topical retinoids and when you might want to start using them, the next part is to understand how to apply them. So, because topical retinoids can cause a lot of dryness and irritation, what I typically tell my patients is, first off, you want to start by washing the face and then patting it dry and applying the product onto dry skin. That will help minimize the irritation and dryness. The second step is that if you're experiencing a lot of dryness and irritation, try putting the moisturizer that you use on the skin first and then apply the topical retinoid after. You can even do what's called the sandwich method, where you then put another moisturizer on top of that. If you're having a lot of dryness, typically in the areas around here, or under the eyes, you can use a Vaseline or Aquaphor or CeraVe healing ointment. Any of those greasy based ointments are going to be a little bit better for helping maintain the skin barrier. So you can use a tiny bit of that to help minimize. And this can really help in the winter when it gets a lot colder. I promised I would give you my top 3 over-the-counter retinol treatments. My very favorite topical retinoid that you can get over the counter is the product called Alpha Ret by Skin Better Science. By the way, none of these recommendations are sponsored. These are just my favorites. So the Alpha Ret product is about $135 for 1 ounce of product. So it's the more expensive tier of these, I would say. But I like it because the alpha refers to alpha hydroxy acids. They include glycolic acid, and they also include other products that are helpful for the skin, like ceramides, squalene, niacinamide, hyaluronic acid, and some other soothing ingredients ingredients. My next favorite retinol is the Retinol 0.1 Intensive Cream by Avene. This product clocks in at $79 for 1 ounce. It's formulated with retinaldehyde, and it also has thermal spring water and peptides in it. And I also think that this is a rather elegant formulation, doesn't cause a lot of irritation, and has the active form of retinoids such as retinaldehyde, so it's a little bit stronger than some of those other forms. And my final favorite in the less expensive tier is the CeraVe Retinol Resurfacing Serum. What I like about this product is that it contains ceramides, it also contains licorice root extract, which helps brighten the skin, and it's encapsulated so it's less likely to cause skin irritation. This clocks in at about $23, so it's at a lower price point, and the form of retinoid that's in it is retinol. So it's a little bit gentler and maybe a little bit less strong as some of those other ingredients that we talked about. And if you like this video, share it with your friends, hit the like button, subscribe to my channel, and let me know what else you'd like to know.